Assisted suicide is one of the most highly debated topics in modern America. This was first brought into the scene when Dr. Jack Kevorkian searched for a safe way to end his injured comrade's suffering in the battlefield. As a pioneer in the world of PAS, he practiced what he promoted. Ironically, he was later arrested for homicide due to this practice. When he was faced with terminal liver cancer, trapped at a time of his life after the Death with Dignity Act was proposed in his home state of Oregon, he opted out of utilizing the practice he dearly loved and pushed into the public eye. Although a majority of doctors do not support assisted suicide, there are still many professionals out there in the world that do advocate the practice. I will neither give a deadly drug to anybody if asked for, nor will I make a suggestion to this effect. This excerpt from the Hippocratic Oath, a doctrine which doctors must sign and stand by in order to retain their degree in practice medicine, acts as one of the core values of today's doctors. Legalizing assisted suicide would negate that statement as well as many others from the document that is the basis for the modern medical practice and is at the heart of American medicine. Yet, somehow, doctors like Dr. Kevorkian, also known as Dr. Death, support and take strides towards the legalization of assisted suicide. Why? The answer is highly opinionated. Those that support assisted suicide believe that the escape from suffering would be better for life. But who is to say what is better for life? Who is to deem a life good or not? Who is to say that a life is not worth living? No human has the authority to decide the quality of life. Every life is worth living. Every life will have struggles. Every life will have hardships. But in the end, every life is purposeful. Every life is priceless. The legalization of assisted suicide would devalue life itself. But we are not only undermining the core of medicine and the value of life by legalizing assisted suicide. Legalization of assisted suicide enables those labeled terminal to escape life. In order for doctors to give the terminally ill this loaded gun, they must give a 6-month or less prognosis. But according to a 2008 case study done by the famed Mayo Clinic, 80% of prognoses done by some of the top doctors in America were incorrect, misled the ill to believe they had less time on this earth, less time with their loved ones, less time to live their life to the fullest extent. By doctors assuming divinity and giving life sentences of 6 months or less to their patients, they are cutting the lives of those taking advantage of assisted suicide short. It is nearly impossible, even in today's technologically advanced world, to predict death. Now let's say a random patient is given a 3-month prognosis by his almighty doctor. If he were to put in a request for this medicine to take his life, he would have to go through a 2-month evaluation period in order to have the chance to even receiving this escape. After this 2-month time period, he would have to wait anywhere from 15 days to 3 years to get the gun put in his hands. In total, the wait time after the first of 3 requests to use the escape as assisted suicide can be as long as 3 years and 2 months, which happens to be far beyond the 3 months he was given to live on this earth. After the long wait comes time to do the act. The medicines used in assisted suicide have a very unique 30-minute death time. 5 minutes of horrible, agonizing, miserable, painful, and flat-out torturous consciousness, and 25 minutes of uncontrollable unconsciousness. During the 5 minutes agony, the patient suffers from horrendous side effects such as convulsions, asphyxiation, and uncontrollable vomit, all of which can cause one to choke on their own vomit. This suffering, which is in no way dignifying, defeats the purpose of assisted suicide. After the 5 agonizing minutes, there comes a 25-minute period of unconsciousness. During this time, the patient is slowly dying. But 20% of those seeking the escape come out of the unconsciousness and live their life with more suffering and less autonomy than before they tried to kill themselves. How is suffering and pain during a passive death dignifying? Who has the right to consider a life worth living, and when in America we believe all lives are worth living? And how is it that suicide is alone a felony, but all of a sudden when a professional who has no right to assume divinity and give short life sentences to their patients gets involved, allowed? Here in America, we are one nation under God, not one nation under man. So we as humans, we as Americans, Even those who have achieved mastery in the medical field cannot assume divinity and predict our fellow humans' deaths. 80% of the time, medical professionals are wrong in their prognosis, which leads to lives being wasted. Precious, precious lives being wasted. We cannot and should not stand passively by as the lives of the terminal are being thrown in the trash. It is necessary to remember that there is no light without darkness, no rose without a thorn, and no life without struggle. Life cannot be valued and it will never be. Life is precious. Life is priceless. Every life is worth living. And to allow assisted suicide, to allow an escape from life, to allow an escape from suffering even when there is a cure, is to undermine the core principles of modern medicine, is to devalue life, and makes living and fighting meaningless. Thank you.